So, if there's a supracondylar fracture, we want to also establish how this will look like on an X-ray. So, how would the X-ray of a supracondylar fracture look like? So, let's establish this fact. So, X-ray of supracondylar fracture. So, just like I told you guys, what is a supracondylar fracture? It's fracture of the humerus, okay? And this is like the downside of the humerus. This is close to the elbow. Okay, so you have a fracture around this place. You call that a supracondylar fracture because down here, the condyles, the epicondyles. So if a fracture is occurring above the condyles, you call that what? Supra. Supra is that's above. So it's a break that is just above the elbow in the distal humerus. It's very common in children. So general appearance is on an X-ray. You see that there's a fracture line. So you see that there's a clear break across the supracondylar region of the humerus. Okay, it could be transverse, it could be oblique. So displacement, the distal fragment is shifted to the back or to the front, but mostly to the back. So soft tissue sign, you look for what is known as a fat pad sign. Okay, fat pad sign indicates that there's joint effusion, and this can suggest that it's an occult fracture. Okay, so moving. Uh, okay, then we'll have different fractures which could show different signs. So type 1 is non-displaced, the cortex is intact and the fracture line may be subtle. Type 2 is displaced with fracture. Okay, displaced fracture of posterior cortex intact. So you see that this one is a classic type 2. In the front is busted, but at the back is intact. This one is a classic type 4 even. This is type 4. Everything is completely displaced and disconnected. This should be type 1. I can see a fracture line, but the bones are still in communication. So that's what we call the Gartland classification system of classifying things. So type 3 is completely displaced with no cortical contact. So you can call this type 3, you can call this type 4. This one I cycled here. Okay. So there's an addition known as type 4. Okay. So radiographic clues include there's anterior humeral lines, the Bowman's angle helps to access alignment and angulation. But if you see that two bones are malaligned, you should always know then posterior displacement. So most at times the bone here is going to the back. Okay, this one here is going to the back most of the time. So this is what we got, and this is how X-rays for supracondylar fractures are possibly to look like.